Hello, everyone, and welcome to the Alliance of Nurses for Healthy Environments webinar titled The Health Impacts of Federal Climate Investments. This is part one in a two-part series on how climate investments that were made through the Bipartisan Infrastructure Law, as well as the Inflation Reduction Act, how together these have represented the largest investments in climate resilience in the nation's history, and are providing much needed resources to communities across the country. The IRA alone delivers near $400 billion in federal investments to rapidly accelerate the transition towards zero-emission vehicles, reduce climate pollution and carbon emissions, improve air quality, and strengthen communities. These historic investments are presenting an opportunity to make lasting positive health impacts for all Americans. So it's really important that we ensure these are kept in place. Part two of the series is going to be held on February 5th, same time, and it will focus on electric school buses and clean energy programs and health systems. So I'm thrilled to announce that we have a really awesome panel of speakers today who will be providing an overview of how climate investments improve health outcomes, examples of local benefits to communities, as well as opportunities for nurses to promote implementation at a state and local level of these programs. Before we jump into the speakers, I just want to run through some housekeeping items. We do ask that folks stay muted throughout the presentation. We will have an opportunity for Q&A at the end of the session. We are offering one nursing continuing education. You will receive an email following the webinar with the recording and a link to complete the evaluation and post-test. You must complete the evaluation and post-test to receive nursing CE. And lastly, we will send out the recording to all those who registered for the webinar, and it will be posted on Annie's learning site afterwards. So first, I'm thrilled to introduce Erin Pedakowski, who is a longtime friend of Annie. We've been partnering with Climate Action Campaign for a number of years now. Erin is the Senior Program Manager at Climate Action Campaign. His work focuses on reducing climate pollution and accelerating the transition to clean energy. At CAC, he works with the Climate Coalition to take federal action addressing the climate crisis. In the past, this included work to pass and generate media attention to promote the Inflation Reduction Act. So he's going to give a quick overview of these major pieces of legislation.
Thanks, Kara. I'm so excited to be here. I'll go ahead and share my presentation and get started. Does this look all right to everybody? Or is it?
It's not in the full slideshow yet, Erin.
Looks kind of frozen.
How is this?
Perfect.
Awesome. Thanks so much, everybody. Yeah, excited to be here. I'll tell you all about the Inflation Reduction Act, but first I'll give you a little bit of background on my organization, Climate Action Campaign. We're a organization of a dozen major national environmental justice, and public health groups working to drive durable federal action based on science to address the climate crisis. Our goal is to reduce climate pollution and accelerate the transition to clean energy and a sustainable society in ways that support justice, jobs, improved health, and quality of life for all. So in this, we have done a lot of work to support both the passage of the Inflation Reduction Act as well as like education about it and why this bill has been so transformative. I worked to help get this passed since a couple of years ago. You may know of this bill as a really important and crucial bill for lowering the cost of prescription drugs. Famously, it capped out-of-pocket costs for insulin at $35 a month. But it's also known for its transformative investments in climate and reducing carbon emissions. It's done a lot to really advance, as Kara mentioned in her introduction, a lot of energy goals and help generate more industry for electric vehicles and a lot of different things. So I'll go into the depth and the history of this bill. But first off is to talk about the background of this bill, and it really came from the negotiations proposed on the Build Back Better Act, which was this really huge $3.5 trillion bill, which was initially proposed to address a whole host of activity, but it was eventually reduced and reworked from its initial proposal to be something much smaller due to internal politics in the Democratic Party. By summer of 2022, negotiations reopened and it became a smaller reconciliation bill with about $1 trillion in revenue from tax reform, 500 billion in climate and healthcare spending, and 500 billion in deficit reduction. And if those of you were following along or you were working in this, a really sad moment came that year when all of a sudden Senator Manchin pulled out and it became kind of dead in the water, and this really amazing transformative bill went away very quickly. But it ended up coming back on July 27th following the passage of the CHIPS Act. Senator Schumer and Manchin announced the 891 billion Inflation Reduction Act, which included climate spending and tax reform. This bill, kind of came secretly following this CHIPS Act being passed. It was seen as a way for Democrats to both get the CHIPS Act passed with a bipartisan vote, and then they could come in and do this reconciliation bill for the Inflation Reduction Act, which resembled some of the initial proposed investments that were in the Build Back Better Act and the other reconciliation bill. But as you'll note, again, a little bit smaller than that 1 trillion that was in the initial bill. And this was a huge, when it was passed, a huge passive piece of legislation that was eventually signed into law on August 16th, 2022. It was crafted to reduce the government budget deficit, lower the cost of prescription drugs, and invest in energy production while promoting clean energy. It became the largest investment in climate in United States history and has been a really huge rallying moment for those of us in the climate community to talk about how important these investments are, how it really has the ability to transform the economy and has done so since its passage. And has done a lot to get us in the direction of our Paris goals, which, as you can see here, I have this graph associated with it. When it was passed, it was estimated to reduce pollution by 40% by the end of the decade. So this graph here shows what the emissions reductions are estimated by 2030 due to the Inflation Reduction Act. You can see that it does not quite hit the Paris target, which is a 50% reduction of 2005's levels of emissions by 2030, but it does get us a lot further of the way there than the business as usual point. Now, there is still potential to hit these Paris goals. Some of the work that's been happening in the climate community has been really furthered and supported by the Inflation Reduction Act's passage. So this graph, I believe, is from Evergreen Action and has this production or this prediction of the levels of emissions reduction that there are. This dotted line represents the 80% reduction from 2005 levels, and it has different levels of climate pollution with different with the Inflation Reduction Act, after the Inflation Reduction Act, as well as some administrative standards that exist at the EPA that were proposed over the past few years in order to get us to this more ambitious, or to our Paris Agreement goals. So some of the work that's been going on in the climate community to work in hand with the Inflation Reduction Act has been to address stronger air quality standards to help protect our health and our climate. So it really has enabled us to do different levels of organizing and protecting public health because of its passage. Now, what's in the Inflation Reduction Act? I have this graph here to show the different breakdowns of it. But there are a lot of different, buckets that this money has gone into. There's some, investments that are related to increasing building efficiency. There's clean energy tax credits, which you can see is like the largest, bucket out of this. This are helps us pay for the clean energy or clean electricity industry, and are benefits that both go to like individual consumers as well as organizations. We have a lot of investments that are going towards, addressing different air pollutants or, polluting industries and trying to make them, more clean industries and improve the supply chain there, as well as, more clean manufacturing and clean vehicle manufacturing. So there's been a lot of investments as well that have been, helping change some of these really big industries in the United States to go more green and to reduce the amount of emissions that are coming out of their respective industries. More here as well. It just goes to show that there's like so many different investments that are going from the Inflation Reduction Act. There's a lot for heavy duty trucks. There's money going to middle and lower income people. There's home energy rebate programs. A lot of these are addressed at like targeting a lot of different parts of the United States' economy to both help businesses make these big changes as well as consumers make these changes. And big portion of this is that there's also been a lot of money that's been reserved for communities that don't meet national air quality standards. So a lot of the Inflation Reduction Act is also aimed at addressing historic inequality and making sure that disadvantaged communities are receiving a lot of this as well. So something you'll also find that's also probably in here is a lot of money is going to rural communities and helping them develop cleaner sources of electricity. To close this out, I have a case study as well that is, example of some of the money that's going specifically to in this case, a hospital. The Office of Climate Change and Health Equity actually has a few different case studies available for you to check out and see the different ways that like Inflation Reduction Act, like tax credits are going to support different industries. So here, Ohio Health's Mansfield Hospital was able to install a electric vehicle charging station. So this was something that was able to support their community, and it was at no cost during the day for the hospital fleet. So this was something that, because of the Inflation Reduction Act, it was able to invest in hospitals and help, provide more of this resource to, both, people working there as well as members of the community who are using that service. So an example of like how this can go further. It's a really good resource. The Office of Climate Change and Health Equity is a good resource for seeing some more case studies and different ways that this can be implemented in the health sector. I'll say that 2.5 years later, we've seen some good results from it. It has started to transform the economy with over 400,000 clean energy jobs being created since IRA's passage. We've had a lot of new clean energy projects in 48 states and Puerto Rico. You can see over $422 billion in investment spent. And like I said, there is a lot of investments going to disadvantaged communities. So it spurred 155,000 jobs in those communities, which goes to show the environmental justice commitment in the Inflation Reduction Act. Unfortunately, I'll also add that this is in jeopardy. As of this week, President Trump has signed executive orders to attempt to freeze or claw back unspent Inflation Reduction Act and Infrastructure Investment and Jobs Act funding. So about 84% of that funding from IRA has already been released. But this freezing is also, preventing the rest of that from getting out. So it is currently under fire. And is something that is, still in jeopardy. So, thus is the need to really promote and educate why this bill is so influential, so that we can stand up and say that we are, defending this bill and we think it's still important. So, that advocacy is still ongoing, and that is what we're working on currently. But thanks so much, everybody. I'll pass it back over to Kara.
Thank you so much, Erin, for that overview of the Inflation Reduction Act. It's awesome to see the positive that's come of it. And of course, we have a lot of work to do to make sure that we preserve that. So I'm happy to switch it over to our second speaker here, who is Robbie Orvis. And Robbie is the Senior Director of Modeling and Analysis at Energy Innovation. Robbie directs the firm's modeling and analysis program, which provides policy modeling, analysis, and design insights to decision makers, think tanks, advocates, and philanthropic groups. As a specialist in energy and climate policy, Robbie routinely works with federal and state policymakers in the US, as well as international policymakers to analyze legislation and regulation and to provide insight on how to achieve climate goals. He has helped develop and deploy the energy policy simulator modules in more than a dozen countries and to analyze decarbonization pathways in each region. So I'm very excited to kick it over to you, Robbie.
Thanks, Kara. I'm going to pull up my slides. And thanks for that great overview of the Inflation Reduction Act. So I'm really happy to have a chance to share some of our research with you all today. Again, I'm Robbie Orvis. I'm the Senior Director for Modeling and Analysis at Energy Innovation, which is a clean energy and climate policy think tank. And so today I thought just would talk a bit about the health impacts, dovetailing somewhat with the last slide there of repealing climate policy. But you can also look at it as kind of what the impacts are of climate policy. And I'm going to talk not just about the Inflation Reduction Act or IRA, but also some of the other policy, particularly standards and regulations that the prior administration passed and the health benefits that come from those policies. So first, just, and I know that most, if not everyone on this call already understands this, but just to reiterate kind of how pollution drives health impacts. So primary and secondary formation of particles, small particles, is the primary way that happens, which can lodge deep into the lungs, and that causes all kinds of health impacts. Primary particulate matter is actually the emission of particles. For example, think about when you burn a fire, or you burn a log, not all of that combusts completely. And so there's particles, black smoke, and so on that come out of that. There's also secondary particulate matter, and that's indirect formation of particles, primarily from these other two pollutants called SOx and NOx. And those are also emitted during combustion, and they react in the atmosphere to form secondary particulate matter. And all three of those are kind of the key drivers, at least, of particle creation and health-driven effects from particles. So, that's just to reiterate kind of the process and how, burning fossil fuels leads to that, right? So climate policy focuses on increasing deployment of non-fossil fuel combustion technologies and reducing the demand for fossil fuels. And because fossil fuel combustion results in direct emissions of particulates, that's PM, SOx, and NOx, then reducing that fossil fuel combustion reduces emissions of those pollutants and the associated health effects. So we have this tool at Energy Innovation called the Energy Policy Simulator. We used it throughout the evolution of the Inflation Reduction Act and afterwards, along with all of the other policies that have been passed, to estimate the impacts of those policies on the US economy, on emissions, and on public health. So our model is completely open source and transparent. We rely wholly on publicly available data. If you want to access it, it's available online. And critically, we track emissions of these 12 pollutants, which you'll see includes a few different types of particles here, as well as SOx and NOx, those two gases I mentioned that contribute to health effects. So the way we evaluate the health impacts of policy in our model follows the approach of the Environmental Protection Agency. So what we do is we use data from the Environmental Protection Agency that translates changes in emissions of different pollutants to changes in health outcomes. And the way they did that is they look at how emissions of different pollutants changes the air concentration, how that changes in health concentrations flows through to changes in health impacts. And then they basically are able to say, okay, for each ton of particulates that are emitted, it causes this much change in all these different health impacts. And we use that directly in the model after calculating our changes in emissions. And all of the impacts are on an annual basis. They're not cumulative. So in some cases you can accumulate findings, but in other cases you can't. So everything I'm going to talk about today is on an annual basis. There's a lot of different health outcomes, and I've included data for all of this in these slides, though I know there's a lot here, though would focus on some of the major ones like premature mortality, asthma attacks. There's some knock-on effects of that, like work loss days and minor restricted activity days. And then, as everyone here knows, these health effects tax the hospital system. So there's a lot of additional hospital admissions and ER visits that result from increased pollution and health outcomes. So I mentioned that we're going to look at actually two different scenarios today. So our kind of current policies or business as usual, sorry for all the acronyms here. This just includes everything, you know, basically as of January 20th that was passed at the federal and state level. So you have the Inflation Reduction Act, you have IIJA as the infrastructure law, you have CHIPS. There's also a handful of EPA rules that are really important for public health. So there's the 111 rules. Those are standards for emissions on power plants. There's also tailpipe rules on CO2. So those are rules on cars and trucks about how much CO2 they can emit, but it also affects the types of cars and how many other types of pollutants they emit. And there's oil and gas methane, which is less important for health, but another key EPA rule. And then I would just call attention to these other two here. So ACC1 and ACC2, these are state rules on clean vehicles. And the EPA has to basically approve the ability for states to do these. And states like California and other states that follow California have really ambitious standards that are expected to dramatically reduce fossil fuel emissions from vehicles. ACT is the same thing, it's just for trucks. And so all of those matter because in our two scenarios we're going to look at one that just rolls back the Inflation Reduction Act. So this eliminates, starting in 2025, all the tax credits, all the funding that's not allocated, and projects that are announced but not under construction, we assume don't happen. And then we have this other scenario, which is the Inflation Reduction Act, but also regulatory rollback scenario. So in addition to all of the rollback of the Inflation Reduction Act, we also remove some of those EPA rules I mentioned, as well as that California car waiver, because these are things that the incoming administration has stated that they are focusing on undoing, and it has really significant impacts on public health. So in blue here, you'll see this is a graph of an increase in annual premature deaths, right? And in blue, you have the Inflation Reduction Act, and in orange, you have the combination of the Inflation Reduction Act and regulations. And so what you can see is that both scenarios here result in a significant increase in annual premature deaths from air pollution. Under the Inflation Reduction Act, it's about 1,300 increased deaths by 2030, growing to about 1,500 by 2032. And in the scenario where you also roll back all of those regulations, that number grows a lot. So it continually grows through 2035 and approaches 4,000 additional deaths per year. And that's in large part due to increased coal generation that happens when you roll back the EPA rules. And that coal is one of the largest sources of air pollution and health damages from air quality in the US. So we see a big increase through 2035, especially there. Now, a lot of these graphs I'm going to show, look, the trends are very similar, but the absolute numbers are different. The other thing to note is that these health impacts differ quite a bit by different demographic group. So this is a percent change in the death rate among different groups. But one thing to call out here is that basically white, Caucasian, and non-Hispanics, they have the smallest change in the death rate. And you can see that the change in the death rate is much higher for minority groups. So it's important to recognize that not only does this increase health damages, but it tends to disproportionately impact non-white and other minority groups. We also see a much greater incidence rate of asthma attacks. So in the Inflation Reduction Act rollback scenario, that grows to about 40,000 increased asthma attacks per year, which you can see in the other scenario, again, driven in large part by the resurgence of coal generation. That number grows to more than 100,000 additional asthma attacks per year by 2035. Similarly, we see increased respiratory symptoms and bronchitis. Again, the trend is similar. So this is growing to upwards of 70,000 increase in respiratory symptoms and bronchitis by 2032. But under the IRA plus regulatory repeal scenario, that number grows to more than 150,000 by 2035. Again, increases in non-fatal heart attacks. So you can see again that this is getting to almost 2,000 under the IRA repeal scenario and more than 4,000 approaching 5,000 by 2035 under the IRA and regulatory repeal scenario. We also track changes in acute bronchitis. I should just mention that all of these relate back to the data that EPA tracks and has available, which is what the health indicators that we include are based on. So you can see again that there's a big increase in acute bronchitis cases approaching 5,000 cases per year by 2035 in the IRA and regulatory scenario, and 2,000 per year by 2032 in just the IRA rollback scenario. So we also track changes in lower and upper respiratory symptoms. So these cases grow significantly as well. I think I'll go quickly through these because I think by now you see the trend across them that there's a significant increase in both the IRA, but also the IRA and regulatory scenario. Same for upper respiratory symptoms as well. I mentioned also that not only do these policy changes lead to increased health incidents, but they also tax the hospital system significantly. So one thing we see is a big increase in hospital admissions. So under the IRA scenario, we see about an additional 400 admissions due to cardiovascular issues by 2032. And under the full repeal scenario, that grows to more than 1,000 per year by 2035. Relatedly, we have respiratory hospital admissions, so those increase as well, up to about 400 by 2032 in the IRA scenario, and over 1,000 per year again by 2035. So, and similar for hospital admissions here, similar set of data and trends. And then for respiratory ER visits, we see a similar trend as well. So big growth through 2035. I was also going to mention that this has a tax on the economy as well, because when people are sick, they can't work and contribute. Two other metrics we track is a change in minor restricted activity days. This is an EPA term and something they use to estimate the value of different policy proposals. So these are days in which outdoor activities are restricted, and so you see this grows dramatically under both scenarios. So almost 1 million more minor restricted activity days by 2032, and approaching 2.5 million by 2035 under the IRA and regulatory rollback scenario. Additionally, we have work loss days. So these are days of work lost from being ill. So this number increases to over 150,000 by 2032, and then approaches 400,000 by 2035 under the IRA and regulatory rollback scenario. So I'll leave it there. All these slides will be available. And if there's any questions about our modeling or anything, happy to take those when we move to Q&A. But for now, I'll turn it back to Kara.
Thank you so much, Robbie. I think that paints a pretty clear picture of why these pieces of legislation, but also regulations, are so important to keep in place. With that, I'm gonna introduce our final speaker of the webinar. Our final speaker is Stefan Samaripaz, who is the Senior Local Policy Manager at American Council for Energy Efficient Economy. There he conducts research, analysis, and outreach on policies and programs that encourage energy efficiency in local communities. His work currently focuses on supporting local government-led clean energy initiatives and scaling up energy efficiency investments in affordable housing. Prior to joining ACEEE in 2016, Stefan worked with community development and housing organizations in the Atlanta metro area. Stefan worked with Cobbs County Community Development Agency, and he worked with Georgia Advancing Communities Together, conducting research on policies affecting Georgia's housing and community development organizations. And I'll turn it over to you.
Okay, hi everybody. I'm just going to share my screen real quick here. Okay, all right, I think we're good. Okay, so let me do a little prefacing before I just launch into the slides here. I guess a good way to think about this presentation is that, you've got all these federal funds that have been flowing into local communities. And, part of the original legislation that's been talked about is that there were set-asides and considerations for making sure that, all this investment reached disadvantaged communities in particular. But, here's the thing is that, what we found in working with local governments, we do a lot of technical assistance, so we do one-on-one work with local governments across the country. What we've tended to find is that at the end of the day, that there's still a lot that local governments are responsible for that is not just, if they want to produce racial and social equitable outcomes in their community and think about disadvantaged, underserved communities, then there are a lot of things to consider that don't necessarily come at the discretion or direction of the federal government, right? And so, what I'm going to highlight today is what we've seen at the local level, local governments doing in their own work and their own programs to make sure that those disadvantaged communities that are oftentimes at the forefront, getting the brunt of the effects of climate change, that those folks are actually benefiting from all this, right, in multiple ways. So with that, I'll get into this conversation. Again, if you're not familiar with us, American Council for an Energy Efficient Economy, or ACEEE, we're a research nonprofit, national nonprofit. We do all things energy efficiency that you could imagine, basically. I'm part of one of our policy teams, so we do work at the local, state, and federal level. But we also have a number of teams that look at building systems and look at electric vehicles and the efficiency of motor vehicles or our freight system, right? Industry. So that we have all sorts of manner of different research work that's going on. And like I mentioned, we also do a lot of technical assistance these days. I've kind of done my little intro, so I'm just gonna breeze through that. So I want to mention that a lot of what I'm going to present on today in terms of giving examples of how to take a more equitable approach with clean energy programs, whether funded by federal dollars or other dollars, really. I mean, this applies across the board, is I'm going to be drawing on our City Clean Energy Scorecard, which is a report that I lead and come out with. We come out with this every couple of years. And throughout this presentation, there will be some links like you're seeing right here. Definitely, if you get the slides, check out the resources that I'm alluding to. There's just a ton more detail that we have online for some of this. But let me introduce the City Scorecard first really quick. So like I said, we do this report every couple of years is kind of the cadence that we have going on right now. And it takes a look at the 75 largest cities in the US and takes a look at the clean energy policies, programs, all the efforts that they're doing to reduce greenhouse gas emissions and hopefully, again, promote these equitable outcomes in their community. Take a look at all those initiatives, and also to the extent where possible, we're looking at the performance. How are they actually doing on achieving their goals, right? And as you can see here, we look at some different sectors, buildings, transportation. We look at utilities and generation of like renewables, for example, and also look at some cross-cutting areas too. So we take a look at all the activities that folks are doing in these big cities, and we come out with a series of metrics that assign points to each of the actions. And the points are, as best we can, trying to, those actions that are more impactful, reduce more greenhouse gas emissions, or are essential to promoting equity. Like we try to assign more points as we can to those activities. And then we score all the cities. We come up with these rankings to sort of show, who's at the leading edge of pushing for advancing clean energy and doing so equitably. And so this is what you're seeing from the last edition this past year. And so in looking at the equity-driven activities of cities, we realized that we came up with sort of like three sort of key trends that we were observing. One is that when it comes to programs, there are a lot of different programs that are being made available to disadvantaged individuals and groups. And it can be really confusing sometimes to try and access all that. It can be really difficult to get all the help and support that you might be eligible for. And so streamlining access to those existing programs, making it simple for people to participate, that's a really important thing. Forming community partnerships so you're growing your clean energy workforce. We can talk about, sort of retrofitting buildings and making them healthier and more efficient, and, reducing greenhouse gas emissions from the transportation sector. But we need a workforce to make sure that is actually, happening, right? And hopefully a workforce that is drawing on and giving careers for folks in disadvantaged communities. And then the third sort of trend that came out of doing all this is that a lot of folks are increasingly working to require that all their clean energy programs and policies that they undergo some sort of equity evaluation as they're being developed, and then potentially through implementation also. So what I'm going to do, rather than give you sort of the three different cities to show each of these different lessons, I'm going to talk about one city, and I'm going to talk about some different programs. And why I'm doing this is because the programs that I'm going to talk about, you're going to start to see as I mention them, is that they all intersect with one another, right? And I think that's one of the important things to think about with all this is that, again, the more you can streamline, the more you can bring all these efforts together and make sure they're complementary. That's really going to make sure that you've got the impact in terms of greenhouse gas emissions, in terms of health, in terms of equity that you want to see. So we'll talk about an example of streamlined programs in this Built to Last pilot. Built to Last pilot, just real quick, is essentially it's a weatherization program, although it incorporates a lot of different other aspects to it, for low-income homeowners in Philadelphia. Some reasons for why this initiative was started. So unique to Philadelphia, well, not unique in the first sense, but has very high poverty level. But what is sort of unique about Philly is that those with low incomes, among them, there is a high home ownership rate. But the fact that they don't have a lot of funds mean they can't really keep up with all the maintenance or repair on their homes. They're not doing a lot of rehabs or renovations, right? And so that creates all these health risks, right? Asthma attacks, falls, lead poisoning. They're not energy efficient, which means that folks are spending a lot of money to keep up with their energy bills to stay in their homes. And there's what Philly realizes is that there's all these programs out there that could address these various different aspects of the problems that these low-income homeowners are facing. But, it was really disorganized, and it was hard to get access to everything. And sometimes you hit a dead end when maybe if you had a little help as an applicant, you might have not hit that dead end, right? So they saw those issues and they said, okay, well, we need to streamline all these offers that are available to this target audience, right? And we need an entity that can sort of work across the different programs being provided in Philly. And so they turned to the Philadelphia Energy Authority, which runs a whole host of different clean energy, energy efficiency, renewable energy programs, electrification programs, and provides investments across the city for that work, right? And so they really saw PEA here as this uniquely positioned independent authority that could really facilitate all this coordination, and ended up doing 2 pilots in 2021 and 2023. And just to give you a sense of sort of, okay, there's all these different programs. these are all the different programs that this one initiative Built to Last is working to integrate, right? And these are all separate programs. They all complement one another in multiple ways, right? They have the potential to. And so, this is really about bringing all those together for folks that qualify for them. The way they do this, it's a 3-step sort of process that's key. We won't go into all the details, but upfront, when someone applies through Built to Last, they get an expanded benefit screening. So they're looking across all the different programs. They're taking the information of the applicant. They're saying, okay, how can we make sure that we get this person all the assistance they need? And they go into the property and they're thinking about doing these upgrades, right? And fixing the home. They're thinking about all the different things that could be done to improve this home, right? So they're not just looking at energy efficiency, and they're not just looking at things like health and safety repairs. They're looking at all of that and thinking, okay, well, what could we do here that maybe even the homeowner, when they came to us, was not thinking about? And then at the end of the day, again, we've got all these programs with people doing work across them, right? So you got to coordinate making sure to bring them all in at the right time and doing the correct work. So it's a lot of work, but they've seen some really good outcomes from this. Second program to mention here is the Green Retrofit Immersive Training Program. This is a workforce development program. There's a whole case study online about it. And again, administered by Philadelphia Energy Authority. 18-week paid training program to get folks up and into the clean energy field. And what's really notable about this, they're not working in a silo. It's one of the important points that we found in looking across all the cities we did in the scorecard. They're working with a lot of local employers. They're working with a lot of nonprofits to provide training, wraparound services, put folks into internships, and ultimately getting these folks ready to do efficiency work and do it in a way that is truly considering all the important, say, health and safety upgrades that maybe get missed sometimes in a property or get overlooked. So as you can see, when you're talking about, setting these participants up, there's a whole host of different certifications that they're going through. It's a really intensive 12 weeks. And one of the things, so they're working to get folks in disadvantaged communities into these jobs and into these careers. So what they're doing is every Friday over those 12 weeks, they're actually doing these wraparound services. They're doing things like helping folks write resumes, working through like mock interviews, helping them with any support they need to get to interviews and get to jobs, right? And that has been a really important part of all this. After that, 6 weeks, participants are placed in some sort of internship with a local trade center. They're working on getting those skills and doing them, working on applying them. This is very important for all just generally workforce development programs. A lot of attention is paid to apprenticeship programs, pre-apprenticeship programs. And so there's a lot of focus on making sure that that's a key aspect, is that hands-on training. And then again, the PEA is working to, get these folks connected in with opportunities to really get a career going. So they're working with local employers. They're also working with their own initiatives, right? So we talked about Built to Last as an initiative. That's one of the things that these folks who are going through this training are getting connected into. And that's a really important point to reiterate, I guess, here, is that when it comes to workforce development and it comes to the role of, say, a local government can be a good method to sort of just spur more job demand in their city or in their county or wherever it is, right? And so it's good if you're a local government person to think about, okay, how can we use the policies we're thinking about doing? How can we use the programs we're thinking about doing? How can that potentially create demand for clean energy workers? And then work with the community, work with your partners to build up a program that trains folks for that, right? And then hopefully that's a jump start for doing a lot more work across the entire, community. And then last, we'll wrap up here, just checking time, last maybe a couple minutes. Philadelphia also has this racial equity assessments, or it's actually several racial equity assessments. I won't get into it here. There's 4 different sort of methods that local governments that we've seen in our research use to account for equity as they're both designing policies and programs and then implementing them. I'll mention two briefly as we wrap up. I'll talk about the structural equity assessments in the first line, and a little bit about participatory budgeting in the second line, because Philly has experience in both. But if you would like to learn more about these other things here, there's a link down at the bottom to a publication one of my colleagues did that looks at all this in much more depth. So racial equity, Philadelphia assigns racial equity assessments across a number of different internal operations that they do to make sure that a lot of the work that's coming out of Philadelphia and their government is equitable, right? So they have minority contracting goals. So whenever they're doing contracting or procurement, they're looking at whenever folks, as the city considers, as the city considers any new resume streams or changes to existing rates, thinking about how the impact will play out on disadvantaged communities, and making sure that the businesses and the folks in those communities are part of the decision-making process. Anytime we're going through the budget, they have to provide, the requesting departments have to provide information on the potential impacts on racial disparities. And then disaggregated performance data by race. So and this is very important, going back to thinking about all the programs I just mentioned, right? Is like when you're tracking performance and making sure that the program does what it's expected to do, make sure you're thinking about all the different ways in which this may play out for different groups by race, by income, right? And making sure that you're accounting for that in setting up your evaluation process. I will also just mention briefly that Philadelphia had this participatory budgeting initiative in 2021 where they took $1 million and they put it up to the community through a series of different workshops and things and community voting. There was a steering committee that kind of organized all this, allowed them to figure out how to use that 1 million. But that was a one-time thing. And what you see here represented on the slide talking about the people's budget is that the people's budget is this local community initiative that's has been somewhat funded by the city of Philadelphia, but gets money from other places as well. And it took that participatory budgeting as a starting place and then worked to sort of get folks more aware of the overall city budgeting process, and then finding ways to get them more active and engaging in that, so that there are more voices from community when it comes to deciding how the budget is laid out and where the city's money gets spent, right? And you can see some different examples of how they accomplish that. So this just wraps up with a reiteration of those three things we've talked about. I'm happy to answer any questions, and thank you. Yeah, I will stop sharing.
Thank you so much. And everyone, please join me in showing some love to our presenters. So here we go. Those are great presentations here. Thank you to the three of you. Let me go ahead and pin all three of you so that we can see your faces. We do have a couple of questions in the chat, and just a reminder, please, if you have any questions, go ahead and pop them in the chat, and we will use the remaining time we have left for questions. So I do see we had a question specific for Robbie that we'll go ahead and ask. And I'll read the question out here. In the IRA only scenario, why do you see a flattening and decline in 2031 plus, but we don't see it in the IRA plus reg scenario?
Yeah, it's a great question. So the Inflation Reduction Act, the tax credits were only designed to go through 2032. Except the electricity sector tax credits are a little more complicated. They go at least until 2032, or until the electricity sector is 80% decarbonized. But basically what you're seeing is that in that scenario, we're just turning off tax credits and funding, a lot of which expired in 2032. So when you're looking at the change in health outcomes, that change starts to diminish after 2032, because in both the IRA repeal, and also in the current policy scenario, you wouldn't have tax credits anyway. So you see the effect grow through then and then kind of taper off. In the other scenario, you have the IRA repeal as well, but you have other regulations that extend basically indefinitely. So the EPA power plant rules and the vehicle rules, as well as California's vehicle rules and other states that follow, those get more stringent through the mid-2030s, and then they basically hold at that level indefinitely. And that's coupled with some other things happening, like electricity demand is growing from data centers and electric vehicles. And so you see the impact of removing all of those things together actually stays like pretty consistent and continues to grow somewhat all the way through 2035 and actually all the way to 2050 if you extend the timeline. So that's mostly a product of the way the tax credits in IRA are designed, coupled with the fact that these other standards extend beyond 2032.
Great, thank you for that explanation. We have a question for Stefan, which in your presentation, you mentioned the Built to Last program helps renovate and weatherize homes. Does the program in Philly also help families that have children with elevated blood lead levels, sorry, reduce the lead in their home? This is from a person who works with kids with higher than normal blood lead levels.
Yeah, so I was just checking about, I'm pretty sure that yes, there is there's a lead program that is tied in with that. Yeah, I'm looking back through the list of programs here. Something specifically I have in my notes right in front of me, but I'm fairly confident that that is true. And again, I mean, one of the things to keep in mind in Built to Last is it has only been a pilot. I know they're working to actually make it a permanent program, but it's not quite there yet. And I imagine with something like lead, which often is, dealing with that is pretty costly and requires some really substantial sometimes work in a home that's probably that and some other big spending numbers are some things that I'm sure they're wrestling with and turning those pilots into programs. But pretty confident. I have to double check, but I'm pretty confident that's true.
Thank you. And as a reminder, please enter questions in the chat. And if someone would like to ask a question, feel free to raise your hand. We can certainly get you unmuted, or you can unmute yourself. I have a question that I'd like to pose to the three of you, is that where do you see nurses kind of bolstering the efforts that you all mentioned in each of your presentations? So whether that be a community-based program or EPA regulations, preserving the IRA, what the pieces that we need to preserve. What are your thoughts around how nurses and nursing organizations can help support that work?
I'm happy to start. I imagine Aaron has some thoughts. I mean, I think from my view, one thing that's persistently been challenging about the Inflation Reduction Act is just communicating publicly about it. A lot of people don't know about it still, and they don't know that it does anything related to public health or climate. And so I think that especially in this new era we're entering, as much as folks can be talking about all of the different ways it's benefiting Americans and our health. And I mean, you got a bunch, not from me, but you got other good examples from the other panelists about even kind of like direct ways it's affecting local communities and hospitals. I think communication about the importance of it is really important, and raising awareness of it. That's at least for me, but I'm not an on the ground advocate, so defer to the other panelists if they have other thoughts.
I can add a couple of things. I mean, one is, obviously, advocacy can be helpful, and in terms of making sure that when you talk about what these programs or these investments have the potential to do, again, it's going back to my presentation, right, and talking about the equity angle, like making sure to not forget that advocacy is needed at a local level. And that's really where you get a lot of impact in terms of thinking about equitable outcomes of all these programs that are being stood up, right? And so it's the little details in the actual implementation that really matters. And so paying attention and then showing up to push for things that will or stand beside. A lot of times, it's standing beside advocates who are already pushing for these sorts of programs. That can really be really impactful. There are certainly, and I'll add, there are certainly models out there potentially to think about. We have other research that that's looked at the intersection between doing home weatherization or energy efficiency retrofits and like health outcomes. And like, for example, there's a program that I'm not sure if it's still around or not, but it's a program in the Bronx that we profiled in a publication that where a hospital that was working with asthma patients actually created a referral system to also for those folks that were willing to have their home looked at for potentially weatherization. So there's a nice coordination between this community weatherization partner and a hospital about finding ways to link those two things up and get those folks who were having these poor health outcomes, the assistance that maybe they needed beyond just the medical treatment, thinking about what's happening at the home too. So I think there's other models like that to take a look at.
Yeah, I'll just add that, as the other panelists have mentioned, that advocacy is a really important step for people to take to be involved in, supporting public health broadly. I think that people here today, by being at this panel, are already in touch with a really fantastic organization, Alliance of Nurses for Healthy Environments, and that they are really good stewards of finding opportunities for health professionals to participate in different levels of advocacy. For those of you who may not already be aware, I'm going to parrot a big thing that Annie says, but nurses are of the most trusted voices that we have in America, and being able to share your experiences as healthcare providers, as experts, is truly crucial for any level of advocacy that you're doing at the local level or at the federal level. Being able to share your expertise in support of the actions that the climate community is doing to, continue to protect the Inflation Reduction Act, that is super crucial. So organizations like Annie will, continue to, stay in touch with you and have opportunities if you want to get involved, I'm sure. But at this point, just to, speak to, the experiences that we're looking at in the climate community, it's challenging because we don't have an administration that is very collaborative, and we don't have a Congress that is particularly friendly to climate currently. So as of right now, it's a lot of looking at ways that we can continue to share our expertise and show that, like, the popular and really important thing for the United States government to address is climate, and that there are people here today who are still really involved and active in that work. So being able to share that you're part of that majority is what's going to be crucial in this upcoming 4 years.
And I think that's a really fantastic way to round us out. And I will, I think also just to mention, Annie's going to have a lot of opportunities for you all to engage in the coming months. And I think, we're not going to see the Inflation Reduction Act go away. I mean, there's funds that have been already dispersed, and there's no going back on that funding. There's programs that are being implemented. So we will see positive impacts from the Inflation Reduction Act. I think where our advocacy is going to come in is in preserving, like Robbie was mentioning in the chat, there is funding that has been frozen. And also I think tax credits are going to be particularly vulnerable. And so we are certainly going to work with partners to be able to fill you in all on ways that we can uplift our voices as nurses. So I want to thank our panelists again. And for those who attended, please make sure you join us on February 5th. We're going to hear very specific examples relating to electric school buses and health systems of programs that are already being implemented as a result of the Inflation Reduction Act. So thank you everyone for your attendance, and we look forward to seeing you in February.